going with the shawl right now.
I'm in Arizona, so it's not because it's cool. It's because the air conditioner is
Right.
cranked. So, so I will. It may put it back on again, but for the moment, I got warm. But yeah, so we've had great sessions today so far, Jamie.
Great.
Kelly Gunter was on talking about surviving sexual abuse, which was a really heavy, but she did a great job, with it with the topic. And then Troy Love was talking about, our inner those inner wounded voices, and how the voices of shame. And so it's been good sessions, and looking forward to yours as well. So
wonderful.
Yeah. So for those of you joining, we're going to be starting in about 5 minutes. You will be able to ask Jamie questions by typing them I am to me, and I will ask them after her time of presentation. And if you request to share, I'm going to hit X because this is being recorded. We want to have this along with the other previously recorded videos on the In the Rooms platform so that people can see them, watch them, rewatch them, anytime, day or night. So it's a great opportunity for that. The next Super Saturday Recovery Summit will be Saturday, September 19th. And then the one after that is Saturday, August 17th. So I know the dates. I just don't, I know, I remember I've got Dr. Ken Adams on in October talking about enmeshment, parental enmeshment. He has one of our top podcasts on the sex, love, and addiction, because there's a lot of people that struggle with parental enmeshment. So hope you join that. Join all of them. Dr. Rob will be on in September. Dr. Rob Weiss I work with him. He's the one that first connected me with Jamie, and we've got a fan club. Dr. Rob and I are a fan club for Dr. Jamie. So it's good stuff. So.
Well, the feeling is mutual.
Yeah. So it's good. It's nice. One of the huge advantages of, doing all of this work is I get to meet amazing people. So it's really fun. So, and people dedicated to doing things that help other people make their lives different,
Sure.
Rather than just living in our addiction. And well, I would have been dead in my addiction. So I'm grateful to be alive in my recovery. So yeah, it's good stuff. So are you currently in Ohio?
I am, yes. This is my home office setup.
The green screen.
The green screen, yes.
Yeah. You were traveling last I saw you, so I wasn't sure if you landed home. So
I'm home, yeah.
Yeah. So I was driving through and I was emailing with Jamie. My daughter was moving. So I was in New York, and then I went to my parents in Michigan, and I drove down the Ohio Turnpike, and she's like, "You're in my state." So temporarily it was driving through. So yeah. So we're going to start in about 4 more minutes. Thank you for those of you joining us. This will be a recorded session. We're going to have a presentation by Dr. Jamie, Addiction as Dissociation. So I forgot to mention, if you click on the link at the top of the screen, in the blue bar across the top, click on that one. You'll be able to follow along with the presentation, or download it and look at it later, whatever works for you. But her contact information is also on there, so it's good information to have. If you've got questions, you can IM them to me, and I will ask them after she's done with her presentation. If you request to share, I'm going to click X and delete you from the box. This is recorded, so we want to keep it just to Jamie and your questions. Like I said, I'm happy to do those. So, but do you have a copy of your book handy so you can hold it up too?
I do, actually.
Good. Well, and this is her latest book, so this is not just her only book. This is her latest book.
Yes, this is Trauma and the 12 Steps. It came out officially last month. Thanks to Kenny and RT for making it Book of the Month last month on ITR.
There you go. Yeah, good stuff. So you would think I'd be all caught up on my reading with, I still have to order yours, but you'd think I'd be all caught up on my reading with COVID.
Oh, we're never caught up.
No, there's like, yeah, I'm like in the middle of 3 different books. I mean, it's ridiculous. I was like, just finish one and then go to the next one, but silly.
I'm also happy to announce that on September 30th is our tentative release date. My company is putting out 2 supplementary resources that go along with the main Trauma and the 12 Steps book. We're putting together a day-by-day recovery reader
Oh, great.
with trauma-informed meditations and a step workbook.
Oh
So,
my gosh.
yeah, people asked for it after the first edition. Just
Yeah,
wanted
I'm actually gonna, and I'm thinking, I'm making a note. I think our treatment center, that would be a great one to have at our treatment center available for that. So,
and I'm sure I'll mention it during the presentation, but for those of you who don't know my work yet, I'm very pro 12 step while also being appropriately critical where I need to be of certain things that happen that are not optimally healthy. And I really bring in a lot of the trauma perspective into how we can work 12 steps. And as we'll talk about today, the dissociation perspective too.
yes, which isn't dissociation why we acted out? I'm kind of thinking, yes.
You'll hear all about it. Stay tuned.
I'm like 100%. Yep. Don't want to be in my reality. So go to that altered one. So, hi, for those of you joining us, glad you're here. Jamie Marich, Dr. Jamie Marich is going to be presenting in just a moment. If you click on the blue bar at the top of the screen, you'll see Addiction as Dissociation. You can click on that and you can download her presentation, follow along, or save it for later. If you have questions, she's going to be presenting for about 40 minutes. If you have questions, IM them to me and I will ask them of her. Please do not request to share because this is different than your typical meeting. This one is recorded, so I'll ask your questions. One of the last ones, they gave details and I asked it more generally. I didn't share, that specific detail. So ask me questions to ask Dr. Jamie and I will do so, but we'll make sure we preserve your anonymity, within that as well. So it's time. So it's time, Dr. Jamie, we're going to get started. So she just held up her book. I'm going to ask her to do it again once we get going, but Trauma and 12 Steps. It's a new book. And she was just telling us about her new trauma meditation book, but all of her work, well, I guess I don't know that. I think of you as work around trauma. So I don't know if all of your work is around trauma, but it sure feels like that's where I'm connecting with you on that.
Pretty much, because other books I've written on expressive arts and meditation still always have that trauma-informed focus to them, sure.
That's great. So, okay, well, we're going to get started. I'm going to mute so that I don't have a random phone call come in, but take it away.
So hello, everybody, and thank you for coming to today's presentation on addiction as dissociation. I'm happy to be back. I was just on the summit in June, so it's kind of a quick turnaround that I'm back, but I really love what Dr. Rob and Tammy are doing here, and my gratitude as well to Kenny and RT for holding this space as they've continued to hold over all of these years. See, I have Zoom brain. I've been on the computer so much during COVID that I'll be talking and I'll feel like what I'm saying is intelligible. And then all of a sudden I'll get some just brain mush and subject verb agreement doesn't work. So I hope that you'll bear with me today as I share with you on dissociation. So just in the way of professional background, I mean, you can check out my my profile here on ITR if you're not familiar with my work. TraumaMadeSimple.com is a great resources site that I keep where you can read more about me and my work and also be guided to dozens of free meditations, trauma-informed yoga skills, and articles, particularly if you can't quite purchase the books. So Trauma and the 12 Steps is the expanded edition of a book I wrote back in 2012. And this one is new and improved with 8 more years of knowledge and a lot more knowledge integrated about cultural diversity and spiritual diversity and the subject of today's talk, dissociation. And I also want to thank RT for so kindly endorsing the book. And I also see Barbara Jay's in the room too, who runs the Wednesday night trauma and recovery group, which is a meeting that I started and she took over. And it's just very important for me that we have these spaces like the spaces here on ITR to really give voice to trauma. So I am also a person in long-term recovery. I celebrated 18 years on July 8th. And as part of this talk this afternoon, I'll be giving you a little bit of my lead from the dissociation angle, because healing dissociation has been a big part in me being able to maintain long-term sobriety and really have an adaptive life in long-term sobriety. So dissociation, it's one of those words. I'm always curious to know how many of you have even heard of it. And I know we don't really have an easy way to talk back and forth here, but maybe in your questions, some of you will indicate whether or not you have heard much about dissociation. And I will say that the field as a whole, the addiction treatment field as a whole, has been doing a lot better in the last 10, 20 years, especially on working with trauma. And I know one of my voices professionally with the books I've written has been, we have to pay more attention to trauma. We can do it in a responsible way. We can do it in a way that ultimately serves people. But especially since 2018, my voice has now been echoing onto the next level of the soapbox on dissociation, that now that we are more trauma informed as a field and as recovery ambassadors, we have to now be more dissociation informed. So before I get into the technicalities that are on the slides, my sense here is to give you a little bit of a mini lead, a mini qualification here, but really emphasizing the trauma and dissociation parts of what brought me into recovery and how healing trauma and dissociation was in fact required for me. And as it turns out, maybe for people like you or others you've worked with, in order to stay sober. So I grew up in a pretty toxic household. I'll just summarize it by saying that. And I was that kid who always escaped from all of the peril that was going on around me by going really deep into my head. I had a phenomenal imagination. I lived in these fantasy worlds constantly. I was always that kid at family parties that really looked like I was here but not here, kind of zoning out into space. And even one of my main abusive figures in my life from the time I was about 7 or 8 would always say things like, Jamie looks like she's been beamed in the head with a fastball, or Jamie looks like she's been clobbered with a football and is just kind of walking around like, ooh, ooh. And I would be very accident prone and I would drop a lot of things. And it kind of became this running family joke that I just never paid attention enough because I was always so zoned out. So hint, hint, those are all huge signs of dissociation, especially as you see them in children. It's really an inherent protective mechanism of our most primal brain that helps us to either shut down or shut off this disturbing stimuli that's around us. And the thing I like to emphasize when I teach on dissociation is it's not all bad, as we're going to talk about here, that a lot of this natural inherent mechanism does in fact keep us safe. Like, I don't think I would have survived past a certain age if I didn't have those protective mechanisms in place. But something my first recovery sponsor really helped me to recognize is this thing that protected me as a kid. This ability to kind of go into my head and cope with my imagination and these fantasy scenarios ended up backfiring on me when I became an adult, because it really kept me from living in reality and it kept me from practicing acceptance. And I remember that when I first entered recovery, a huge prayer that I had to really institute for myself is, dear God, and that is what I call my higher power, help me to live in reality. Help me to live in the moment. Help me to live with what is, because I had become so used to not doing that really as a way to cope and as a way to survive. So some of you, who've heard my story, and you could read more about it on my book or in my book and other materials. I got sober when I was working in humanitarian aid in the third world, or what we used to call the third world in Bosnia, which is where my family's from. And I was mentored by a very wise sponsor who I've already mentioned that was trauma informed before the idea of being trauma informed was really cool. She knew about trauma. She knew that it was part of my story. And I have said, and I said this the last time I appeared here, that I don't think I would have stayed around and to kind of receive these promises of recovery if I didn't have somebody mentoring me who really understood trauma, who knew not to push, who knew how to give me real practical skills, who knew how to validate me while also challenging me. So where I really became attuned to the role of dissociation in my journey was when I was about 2 years sober. I was just shy of 2 years sober. And I was working on my graduate degree in counseling. My mentor, my sponsor, Janet, and the individual, the priest I was working for in Bosnia, they ended up sending me back to graduate school in early recovery. They thought I'd be good at counseling, and I laughed at them. I didn't know what they were talking about, and here they ended up knowing me more than I knew myself. So I came back to the US. I started a graduate degree in counseling. I did pretty well during my first semester of coursework. And then in the second and third semester, I had to start this practicum and internship process. And during that time, I was working at an adolescent inpatient psych unit. And I found myself being triggered in a way I hadn't quite yet found myself being triggered in my recovery. And it was not the children that were bothering me per se, even though I saw a lot of kids cry and act out in ways that felt very familiar. It was the way that I felt the system treating children, or saw the system treating children. Sometimes it was the medical doctors, sometimes it was other social workers, sometimes it was the child protective services, the courts, parents and guardians. It just felt very familiar to me. Just very, very familiar to me. And I had a colleague who I was working with. He was also a young counselor. He was just a year or two out of school. He noticed these signs of dissociation, that I would just kind of suddenly zone out right there at work, that I would be here but not here, especially when I was overwhelmed, that I would take a lot of breaks just to go outside and cry. And he, in his wisdom, ended up doing a bit of a mild intervention on me, saying, James, this is dissociating what you're doing. And if you don't get this managed in some way, I think that was the nice word he used, you're not going to last very long in this field, because what you're seeing here is pretty typical of how people have been treated. And it seems like it's tapping into some of your own unhealed trauma. So at that point, I was a bit confused, because I was working a pretty active 12-step program. I had worked my steps through. I was a champion with my slogans and my literature, and I didn't take any issue that I belonged in a 12-step program. And I also had a good diet of pretty cognitively driven, talk-driven therapy at that point too. And so when my friend told me, you better get some more help to work with the dissociation, I didn't know what else was going to help, because I felt like I knew what my thinking errors were. I knew which slogan I should be applying here. I still wanted to be sober. I didn't want to lose my sobriety. But in a lot of ways, I was still dealing with things like fleeting suicidal ideation. I also spent a lot of time in my childhood self-injuring. And that didn't really come up as a factor again in early recovery, but it felt like the same kind of darkness and sadness was there that had caused me to want to hurt myself when I was younger. So yeah, I didn't doubt that I needed help, but I knew I would need some kind of different help in order to really kind of solve this and thrive in my life in recovery and really deal with the mental health piece. Because I have heard others share this, and maybe you have related to it as well, where you're sober, but may still want to die because the mental health terror is just there and unaddressed, right? So I had a graduate professor who I talked to, and I told her about this thing that felt like dissociation and that coworkers had called out as dissociation. And she ended up giving me a card and said, here, go see this therapist over in Boardman, Ohio, which is near where I live. She does all the weird stuff. And I was willing to do the weird stuff at that point. So this therapist did approaches like hypnotherapy and EMDR therapy, or eye movement desensitization and reprocessing, which is the thing that really ended up doing it for me in my healing. And I now teach it and write about it. It's been that big of an influence on my life. But more so than the really good embodied interventions this therapist knew, she had a keen understanding of dissociation and really was able to kind of hone in on a diagnosis that, post-traumatic stress disorder doesn't really quite fit what's going on with you, as well as this thing we call dissociative disorder. So some of you may have heard of dissociative disorder. For some of you, it may be a totally new diagnosis. So I'll give you just a little bit of insight in it. It does appear in the DSM, or the Diagnostic Statistical Manual. And the most extreme form of a dissociative disorder is what's known as dissociative identity disorder, or what was previously called multiple personality disorders. And what you may not know about dissociative identity disorder is that it really does form as an extreme response to trauma. Typically, when very young children in developmentally vulnerable years do not get their developmental needs met. And that same inherent system that can cause us to zone out, check out, go within, can also work in a way to essentially split us off from different aspects of ourselves. And before you think, whoa, that's like, I'm not multiple personality, what you talking about? Even our understanding as a field has really grown about what dissociative identity disorder really is. And I ask all of you right now who are listening to me, have you ever identified as having different parts of yourself that feel like they're at war with each other? So a very simple example is maybe there's the part of you that wants to stay sober and the part of you that wants to keep drinking and using and acting out. Those can be two very different parts that have formed in your brain. Some of you may identify as having like this real vulnerable inner child and a very confident adult. Maybe you have like a real angry side that could come out and, be a gangster if you need it in order to protect you or to protect those you love. Maybe there's parts that just feel very turned off by anything sexual or sensual, and parts of you that might feel very just enlightened and excited in that area. That we all have these different parts and aspects of self. And all dissociative identity disorder is those parts taken to an extreme, to the point where those who suffer from dissociative identity disorder may blank out time, may switch, because one part can kind of take over the system so intently much. I do not have the fullest expression of dissociative identity disorder. I was diagnosed with the unspecified kind, meaning I don't block out time. That's never been a part of my diagnostic picture. But I do identify as having these kind of three other distinctive parts that ride along with the adult Jamie that you see talking to you today. And they're basically versions of myself as myself existed at ages 4, 9, and 19. And I won't get into the wholeness of the story, but all of those were very vulnerable years where horribly traumatic things happened. Age 9 was when I first started to injure myself. So care for me has had to be, how do I work with those really young, unhealed parts of myself? And they've all experienced a lot of healing now. I mean, God knows I've had 18 years of therapy off and on in addition to recovery. But the reason my therapy has been healthy or meaningful is because it has been very parts informed. And my therapist then and my current therapist that I see now really understand dissociation, and how a huge part of my coping has always been to kind of just let these different parts take over. And that's something that my brain learned to do when I was very young. So not all dissociation needs to be that extreme for it to be significant. For some of us, the manifestation of dissociation as it is defined does go into that kind of realm of parts work. But the other thing I like to teach on dissociation is that we all dissociate. It is a completely normal part of the human experience to have different parts take over for us sometimes. And it's a completely normal part of the human experience to check out from time to time, especially when we feel overwhelmed. Like a lot of things with mental health, it can cross a line to being functionally impairing if the reason why you're doing it isn't healed. So I have long known that individuals in early recovery, once the addiction, the drug use, the sexual acting out, whatever the object of the addiction, for lack of a better word, may be, once that clears up, I tend to see a lot of dissociation in treatment centers, in folks who come to me for therapy. And as I said, it was a huge part of my story. I was 2 years sober and boom, there it was. And a lot of times this can get written off in traditional recovery as, oh, the pink cloud is passing and now you really have to do the hard work. No, what's happening is that the unhealed trauma that's underneath is still there. That a lot of these initial skills we learn in early recovery and initial treatment are fine for getting us sober. But to really keep us sober and keep us thriving and healthy, there is a requirement to kind of get to the core. And this is my cat, Misty, in the back. She likes to show up sometimes when I'm on a broadcast. So let me give you another example of how I see it shows up, because I told you how it showed up in me. Treatment centers, right? So in groups, particularly in early treatment groups, I often, and I noticed this when I worked in traditional treatment, people would have a hard time paying attention during group, having a hard time sitting still, having a hard time staying focused. And even in my early career as a clinician working with this addiction and trauma cross specialty, I would have a lot of treatment providers send me their clients into my private practice saying they can't sit still during group. Can you help them pay attention during group? And the reason that they can't pay attention is because they're dissociating, because they barely have enough ego strength to keep themselves sober and present, letting alone hearing what's going on with everybody else. And yes, that can be a benefit of group. We're hearing each other's lived experiences, we're sharing experience, strength, and hope, but it's too much in the way most groups are run. And if I had it my way, and this is a lot of what I write about in the book, early treatment groups would be very skill focused, teaching people how to ground, teaching people how to deal with body level distress that comes up when what other people are talking about is too overwhelming. So yeah, I really came to see that it wasn't that people weren't paying attention during group, it was that they were too overwhelmed. And so this dissociative response tended to kick in, and that's where you would see the zoning out, the fidgeting, not being able to pay attention. That's another example of how it shows up in early recovery, and you could see it happen at meetings too. So I have long taught that you have to be working with trauma earlier in recovery than we initially thought, because that is where you tend to see early relapse happen, because the chemical or the behavioral use is no longer there, but the wound impact is still there underneath. And yes, there are responsible ways to do it. It's not just like, let's plug in and deal with the deepest, darkest wounds, but teaching people wound care that is very embodied can be part of trauma-focused care. Like I said, groups ought to have at least 3 skills that you're teaching in each group. Something dealing with grounding, something dealing with breathing, something dealing with working with distress at the level of the body, listening for cues and signals at the level of the body. I've long believed that your body tells you what's going on long before your rational mind is aware of it. And yes, so many people coming into treatment feel very disembodied. But then the key is, so how are we teaching folks to work with these signals and respond accordingly instead of falling into the reactive patterns of addiction? So a couple years ago now, it's probably going on 2 years ago now, one of my students who I've mentored, and he's now kind of transitioned into the role as a collaborator on this model. And one of the reasons he sought me out to do his advanced EMDR training is because of my specialty with trauma, my willingness not just to work with dissociation, but my willingness to talk about my own experiences with dissociation, because that's still considered a little risky in the fields in which I work in. Like, yeah, it's okay to be out about your addiction, but to talk about dissociation, do you really want to put that arrow on your back because of the associations people have, especially with dissociative identity disorder? And to make a very long story short, and I think this brings my recovery story full circle, a former spouse, as our marriage was driving towards the end, threatened to use the fact that I had a dissociative disorder against me, that it's still that highly stigmatized. And when he tried and failed, I kind of lost any fear that I had at that point about being candid that yes, the dissociation is a big part of how I coped as a kid. It's a lot of what led me to my addictive path. And yeah, my mind still works in very dissociative ways now as an adult, and that's not all a bad thing. It's not all a bad thing. I mean, I think the same thing bodes true for addiction, that what used to be kind of our greatest curse in life, we can learn how to transform it into a blessing. We can learn how to transform it into something that serves us as opposed to something that keeps us stuck. So after my marriage ended is when I became more open about my own personal recovery. And that's when my student, Adam, really wanted to work with me going further on putting this model out there that we call addiction as dissociation. And as I explain this to you, it's going to be so common sense. I like Tammy said when she introduced me, like, well, isn't that what my addiction is dissociation? Yes, to put it quite mildly. And there's a lot of this debate, and there has been debate over the years whether the disease model for looking at addiction is still valid or not, or should we be going towards more kind of trauma-focused, trauma-informed ways of defining addiction. And what Adam and I have put out in this addiction as dissociation model is really, we don't care how you classify addiction, whether it's a disease or whether it's a trauma-focused manifestation. But what is imperative is that you recognize that addiction is a manifestation of the brain's natural tendency to dissociate when we're highly distressed. So I'll give you the model in very simple terms, and then I'll go ahead and pull the slides up. So as I've already mentioned, it is a natural tendency of the human brain to dissociate. And maybe think about when you were a young person. What were some ways that you may have checked out, zoned out, gone within to avoid the pain or the stimulus or any dysfunction around you? I gave you some examples of how it played out in me. That happens, as I talked about, at the most primitive levels of our brain, what we might call this kind of bottom-up brain, or more of the kind of reptilian functions of the brain. And if it happens often enough, our brain becomes bonded to that state of dissociation. Just like if we use anything often enough, our brain can become bonded or attached to that maladaptive experience or that pleasurable thing we're taking in. So just like that, if our brains as young folks dissociate often enough, we become bonded to that state. And dissociation really does kick in as the default, as the normal, especially when we are distressed. And then for many of us, a little later in our childhood or in our adolescence, chemicals are introduced into the picture, whether it be drugs, alcohol, cannabis, sexually acting out, pornography, the list goes on. Food, I often identify food as my first drug of choice. So whenever those chemically pleasurable responses start to happen, it's amplifying the already familiar experience of dissociation, because a similar type of bonding happens in the brain. A similar type of thing that helps us check out happens in the brain. Because the two main purposes of dissociation that we have really filtered down from our own experiences, our clients' experiences, looking at the literature, is dissociation helps us to protect ourselves or to get a need met. And then you add a chemical, you add a behavior, and it amplifies that already familiar experience our brain has already attached to, which is protecting ourselves or getting a need met. And I think a lot of you know that phenomenon, that whatever it is you chose to use, it helped you to check out even more. It helped you to go within in a dark way even more. It helped you to zone out even more. It helped you to numb yourself even more. And so what Adam and I are really arguing in our work is the addictive substance, especially if you've been traumatized, that's not the first time that happened at your brain level, that your brain has already been doing it by dissociating. And then the chemical enters the picture, which can amplify the experience. So then, as I mentioned, for a lot of us, we attain enough recovery to either stop using or to, if we're using more of a harm reduction perspective, maybe cut back. But guess what? The dissociative underpinnings are still there. This tendency to avoid, to numb is still there. And that's what I think a lot of cross addiction is about, right? that you might choose to or be able to stop using the main thing that brought you into treatment. But if you're not dealing with the hurt, with the feelings, with the unhealed trauma that's underneath, your brain is going to go for the next best pleasurable experience possible that will help you either zone out, check out, numb out, all these things dissociation does to us. Or like in my case, your mental health symptoms can just kick back up. And for me, that included dissociation, suicidal ideation, and, and some flirtation with self-injury. And I did have a self-injury relapse a lot later in my recovery, which, I do believe was like another round of unhealed dissociation that I had to, get back into treatment to deal with. Looks like Misty's giving herself a bath behind me. I love dogs and cats and babies. They know exactly what they need in their body at any given time, right? So Misty helps me stay present though, so I can't I can't fault her for that. Right, girl? Oh, yes. Yes. So if you want to go ahead and open up your slide handouts, I'll just recap here on the slides some of what I shared with you about in this brief talk. And then,
hang on 1 second. For those of you just joining or that joined late, at the top in the blue bar, addiction is dissociation. If you click on that, you can download the slides and follow along.
Thank you, Tammy. Yeah. So, and then I'd like to definitely hear some of your questions via chat. You can send them to Tammy via chat, and she will go ahead and filter and give them as part of our question and answer. So yeah, these first couple slides are just some information about me, some information about the Trauma in the 12 Steps project if you want to try it out. So let's come down to the fourth slide here, this Dissociation 101. So I'm a big word nerd, because I started as an English teacher. If you've heard me talk on trauma before, trauma equals wound, that trauma is just any unhealed wound. That's what it means in Greek. And I think so much of what we need to understand about trauma is by looking at trauma as an unhealed wound. Same thing with dissociation, that it can feel like this rather esoteric concept, even to professionals. And I tell professionals that I train, let's break down the word origin. So much of what we need to know about it is there. So dissociation comes from the Latin root meaning to sever or to separate. It's really all it means, that dissociation is a severing or a separation. So what is it that we're severing? What is it that we're separating from? So it can refer to severing from the present moment or severing from these parts or aspects of self. So in a lot of ways, you can think of dissociation as the opposite of mindfulness, right? That if mindfulness is this art of being in the here and now, being fully present, dissociation happens when being in the here and now just becomes intolerable. And it's so natural for our brains to sever or separate. So dissociation is fundamentally a protective response. It is there to protect us. That can develop as early as infancy or even in the womb if a fetus in the womb is picking up on distress going on around them. Because dissociation is one of the most primitive functions of our brain. It's closely related to the freeze response, because in trauma, we talk quite a bit about fight, flight, freeze, but a lot of experts will say it's even more subtle than freeze, that it has more of this quality of shutting down, kind of a freezing to submission, just like going offline is another way I sometimes describe it. So I've talked about some of the common examples of dissociation, which can include zoning out, daydreaming, struggling to pay attention. Hint, hint, it's not all ADD. A lot of it is dissociative. And other ways you may notice being here but not here. One of my favorite movies is 28 Days with Sandra Bullock. And if you've seen the movie, I think a lot of us have, you may recall that scene where she hasn't quite gotten it yet, right? And she's writing a letter to her unhealthy boyfriend, and she's asking him to sneak her in some pills. And she says that whole here but not here feeling will be a heck of a lot easier with a little chemical help. That scene in a nutshell describes what I'm getting at here with addiction as dissociation, that she was uncomfortable where she was at. And it is our natural tendency as human beings to go away mentally when we're uncomfortable. And as she said in that scene, it just becomes a heck of a lot easier with some chemical help. So dissociative responses generally happen to either protect the self, the core self. Some of us may identify as having a system, like these various parts of ourself, our little child, our protector, our more spiritual part, or dissociative responses can also happen to meet a need. Human beings are born as infants with a naturally high level of dissociative tendencies to get our needs met, because that's what little babies have to do. They can't speak and say, this is what I need. But the part that cries, the part that screams, the part that has that tendency towards wanting to be held and cuddled and nurtured, this is an example of how we do what we need to do to get our needs met. In the presence of healthy development and attachment, our brains can become more integrated so that we're no longer having to, let's say, act out like a baby in order to get our needs met. But if we have not learned healthier ways to do that in the presence of healthy development and learning what we need to learn, in a lot of ways, especially in active addiction, we can still feel like there's this little baby inside of us. If you come from the old school of addiction treatment, you may remember the pamphlet King Baby or Queen Baby. And I kind of roll my eyes at some of the pamphlets because I think, we over pamphleted people to death, right, in the early days of addiction treatment. But there's a lot to that concept. And I think of King Baby or Queen Baby as not a shaming thing, but it's a part. It's a part that exists to get our needs met, because those who were supposed to care for us either did not meet our needs, or we never learned healthy ways or healthier ways to get them met. So in the presence of healthy development and attachment, our brains can become more integrated, more harmonious, more cohesive. And when this development is an optimal, a high degree of dissociation can still be likely. So that dissociation can be the severe checking out that I talked about in its various forms, or it can be this kind of severing off of parts of self that just really don't learn how to talk to each other until they are shown how, or until a real healthy trauma-informed recovery is possible. So these are just some highlights of the addiction as dissociation model that Adam and I put out there about a year ago, and that we're continuing to work on and hone. That when children and young people dissociate often, their brains can become bonded to the dissociative state. Dissociation feels comfortable and even normal to withstand traumatic situations and triggers. Even as I read that, see if that resonates for you. When drugs, alcohol, or other reinforcing behaviors are introduced, these amplify the already existing experience of dissociation in the human brain. And then our addictions can become the predominant or the primary way that we sever from the present moment, or that we sever from the self. After a period of abstinence or an attempt at recovery, it's very common for these earlier in life dissociative phenomena to reemerge. It should say life, not live. And thus, it's imperative for addiction treatment to not just be more trauma sensitive, but there's also a need for it to be more dissociation sensitive. And one of the small ways we can start making treatment more dissociation sensitive is to work in more grounding into the skills that we teach our clients. And grounding is something that if you know how to do it as a person in recovery, you can even teach it to a sponsee, to someone in your network. And grounding is really anything we do using any available sense, any available experience to help us stay more connected to the here and now. And hint, hint, it's not enough to just tell people stay in today. Because if it were that easy, I'd do it already. And the way that the mind it can be kind of built to protect us will pull us so far into the past or project us into the future or just kind of click off so that we don't have to tolerate with what's going on around us. So what I'd like to do is kind of close this formal part of the presentation before we take some questions with the grounding sampler. You can never have too many ways to ground. And if you're a professional or work with clients, you can never have too many ways to teach your folks how to ground. I like to say I'm a highly trained trauma-focused therapist. I have a lot of tools in my tool belt. I'm a yoga teacher. I'm a meditation teacher, expressive artist, and I'm still always on the lookout, right, for new ways that I can help myself ground and that I can help people ground. So instead of telling people, just stay in today or one day at a time, our approach needs to be more, well, how can we show people how to stay more one day at a time? Or how can we be in the moment like our dogs or our cats are? Okay, so we'll practice here for about 3-4 minutes, and then we'll turn it over for questions. And I really do encourage you to follow along as I'm giving you instructions. You can always opt out or modify if you need, but especially when we talk about heavy things like trauma or dissociation, it is very natural for unhealed material to come up. And you might be feeling a little shaky right now. So hopefully this grounding sampler can help you feel just a bit more centered before we go on and before you go on with the rest of your day. Okay, so wherever you're at, I'm going to ask you to rub your hands together just to generate a little heat, a little bit of energy. You notice the sound as you rub the hands together. Notice if there's a temperature or a texture in your hands. Now, ordinarily, we teach this exercise as bring your hands to your face. If you're not comfortable touching your face because of COVID or even because of a trauma response, you don't have to exactly touch your face. But you can bring your hands just to the sides of your temples, maybe up into your forehead. And give your forehead just a little bit of this kind of heat and sensation massage. And as you do that, maybe notice if there are any other movements that want to come out in the body. So whenever we can move our body organically, you saw my cat doing it. Like, she's not afraid to do exactly what feels good in our body. That can help our bodies feel more here, more now, and more present. Now, keeping your eyes open, I'd like you to take a look around your space and notice what you see. Notice colors. Notice shapes. Just notice how you observe and describe what's around you. Now moving to your ears, to the sense of sound or hearing. After I stop talking, notice right now what you may be hearing or not hearing. Maybe take a breath and notice if there's a smell in your awareness right now. Or if you have something nearby you can smell, like I keep some oils near me at my desk. Maybe you take a moment to engage that very pleasant smell. Maybe swallow and notice if there's a taste in your mouth or if you have your beverage nearby. Take a sip. And connect with the taste. And then for touch or sensation, maybe Bring some touch contact to your clothes, perhaps touch the table. Maybe there's an object nearby, or a pet nearby, or a blanket that you can make touch contact with. And of the 5 major senses we just scanned, notice which 2 most stand out to you as, like for me, it's touch and visual, just for example. When I'm touching something, I tend to really know that I'm here. When I'm looking at something in my space, like I have this kind of purple background on a painting in front of me that I could look at and know that I'm here and now and present in my office today. So notice which 2 senses most resonate for you. And at any time in your life when you're feeling overwhelmed, if you're starting to notice that you're drifting or that the body is getting activated in any way, my invitation for you is to go to one of those 2 senses. Engage it. And maybe say something like, I'm here. Touching my shawl tells me I'm here. Pressing my feet into the ground tells me I'm here. One last little tip I'll give you is, I heard this in a recovery lead once, but there's a lot of dissociation wisdom right in it. If you're ever wondering where you are at in any given moment, look at your feet or press your feet into the ground. Your feet will not lie to you. It's the natural tendency of the mind to either pull us into the past, to project us into the present. But your feet will always tell you exactly where you're at. And for me, my feet tell me I'm here, I'm now, I'm present, and I'm safe enough. Thank you for practicing along with me. And Tammy, I'll turn it over to you.
And you have some questions. The first one is, someone close to me was very violently abused by her mother, including being hit in front of her father at a very young age. Her earliest childhood memories are of this, and she experiences a lot of suicidal desires and was violent with herself. She is truly suffering, and her mother is now dead. So she is absolutely stuck in this dissociation and physical pain. She is trying to get into an inpatient program, and despite being on medication, still suffers greatly. This person is asking, how can I help and support her?
Yeah. Thank you. It's a good question. I just want to say in general, I typically don't give specific advice on cases because I'm not that person's treating clinician, and there's always so many variables at play. But I can give you just 2 pieces of supportive advice that might apply to any of you who are asking about loved ones or yourself. And that is the importance of being able to validate first, while then also challenging into some kind of action or saying, what's the plan? And if you heard my talk 2 months ago, I talked a little bit about that too often trauma and mental health approaches can be all about, of course that's happening to you because look at your past and look at your past. And it's almost like too much validation and compassion, but we're not helping people actually anchor to the present or challenge them into taking action. And on more of the traditional 12-step end, we can get so tough love with our action and so tough love with our rational pieces of advice that a person's not going to be online to hear it unless they first know they are safe and supported and validated by you. So I think the key is to support through validation, through letting her know that you hear her. And after she feels that sense that she is heard and supported, then to shift your dialogue into something like, what is the plan? And that plan could be something as simple as, yes, let's look into treatment options for you. Or it can be something as simple as, would you like to try this grounding exercise with me? This grounding exercise I just showed you is simple enough for non-professionals to take other folks in recovery through, right? And I think we can always help people feel more attuned to the space that they're in, especially as a supportive bridge until they're able to get the deeper help that they need. Thank you for the question.
Next one is, What is your take on feeling the need to dissociate completely with untraumatic daily events? For example, I know I'm going to be spending a lot of time with my toddler. I want to use dissociation so I can be there, but not really be there.
Yeah, good question. And this, I didn't get too much into this, but I will now in the wake of the question, that there is such a thing as adaptive dissociation or maladaptive dissociation. And an example I use all the time is this. Think of the Netflix binge, right? Or playing on your phone. Those are both technically examples of dissociation if they help you kind of escape the present moment. That's not all bad. I mean, there are times when I'm in a high stress environment and checking my phone is probably a good thing. Could doing a grounding exercise be a little healthier? Probably. But there are other times when checking my phone is obviously rude. It might keep me from paying attention to the information that I need to obtain. And the thing about like watching TV, the Netflix binge, another example of that is I spend most evenings watching a little bit of TV because that is what I need to decompress. It taps into a lot of that tendency I had as a kid to go into fantasy world for sure, but it's not maladaptive to me at this point. And in fact, I think it's actually very connective for me because I love good characters. I love movies. I love TV. I love to laugh. What would be more dissociative for me is if I spent my evenings just working all evening because guess what? I also have tendencies towards workaholism. And basically anything we're doing to keep from actually just being with ourselves. And for me, lying on the couch and watching TV is the perfect way for me to still have a little bit of an escape, but to also just be present to whatever I'm feeling. And a lot of ways TV helps me to do that because I do cry, I do laugh. But if I would just spend the evening working more, that would be more maladaptive. And to your point, a lot of us do need to engage in some activities that help us check out a little bit, for sure. I still have that tendency to daydream, especially if, let's say, I'm sitting at a boring meeting, or that's just an example that's coming up. Where it can become maladaptive, though, is if it's putting myself or others in danger. So if it's putting your toddlers in danger, that's a problem. If it's putting you in danger, that's a problem. So I hope that I help to give some distinction between the two with my answer to the question. Thank you. It's a great question.
It is, and I call it a mental health break. Like I pick a program intentionally that I know is going to be, like you said, make you laugh or do something that you need to do that just gives you a break. Because the stuff that we're doing is heavy stuff too, so
Sure.
it helps. So okay, so the next one is, can you do EMDR and work with dissociation therapists online? A reminder, if you IM me the questions, we're not going to let anybody go to the request to share. So the question is, can you do EMDR and work with dissociative therapists online? I don't have an EMDR dissociation therapist anywhere near me and would like to look at online options. What are your thoughts?
Yes, you can. Throughout COVID, we've been routinely training EMDR therapists to work online, and we've been routinely training EMDR therapists how to work with dissociation online. The key becomes finding the right therapist who is not afraid of either, because we still see EMDR therapists right now who are like, well, I don't know how I feel about working online. If they're not confident with it, they're not going to be a good fit for you. Same thing with dissociation. And like we ran a webinar at the beginning of COVID specifically for helping therapists manage dissociation more effectively online. So yes, depending on what state you're in, I would certainly check out your options because there are therapists out there who will work with both online.
Check out Trauma Made Simple with Jamie. So, okay, next question. I'm 4 years sober and I just found myself ready for therapy. Would this be considered past dissociation?
Again, this is another example of it's hard for me to know without knowing specifics of your case. All I would say is if you're feeling ready, awesome, go for it. Whoever you're working with will help you to understand if dissociation has been part of your profile or how much. And I will say to your point, though, that sometimes when we say we're not ready, Could that really be a dissociative response? Could it be that we're blocking? Could it be that we're numbing? Personally, and I don't want to shame you or chide you if you use the word ready. I don't like the word ready. Because I think, to quote an artist I like, if we say we're waiting until we're ready, we'll be waiting the rest of our lives. That we can always use that, like, I'm not ready, I'm not ready. So whenever I have this tendency to use the word ready, I tend to replace it with prepared. If I'm not feeling ready for therapy, what is it I need to do to get more prepared? Because a lot of times, any block we can throw up for ourselves may be another dissociative sign, that I'm not ready or I can't handle it. Sometimes this tendency we also have to kind of overtalk everything and overanalyze everything when we really just need to feel something. That can also be dissociative if it's keeping us blocked.
So what somebody said so ADHD is dissociating?
There's some subtle differences, but I will say this is why it's important to get diagnosed by somebody who knows trauma. Because, for instance, if you take the diagnoses of ADHD, bipolar disorder, dissociative disorders, PTSD, there are so many overlaps in symptoms. And sometimes you have two of them going on at the same time. Sometimes what looks like ADD, because that tends to be the association we have as Americans, right? Well, you're not paying attention, so it must be ADD. A lot of inability to pay attention can be a sign of unhealed trauma that can show up as both PTSD or a dissociative disorder. So it's important to make sure that you get checked out by somebody who understands the subtle differences between the four. And sometimes it might be that person has to stick with you a while to really know if this not paying attention is something that's more biochemical or if it is more a sign of unhealed trauma.
Interesting. And I could see that you really need to know because you'll get help in different ways with that too. So, okay, this is an interesting question. I tried to date someone with whom I would get really dizzy and off balance around, especially when I would want to get close to him. I had to let the relationship go because of that. Could that have been dissociation? How do you know if your body is telling you the situation isn't good for you or you're dissociating because it is good for you and you're scared? Great question.
Great question. When you figure it out, let me know. Yeah, my relational part of my life is what I'm still working on. Wow. I mean, my tendency is always, if you're under the guidance of a good therapist, a good sponsor, or both, I would take this to them and see what kind of experience, strength, and hope that they share with you. But I will say, the more you work with your body, even if it's simple grounding practices like we did, the more you practice something like body scan, which we have on Trauma Made Simple that you can look at, which is where you're kind of doing an active meditation, scanning your awareness through various parts of the body, you'll know. So when you're in these situations, like with this partner and feeling that dizziness in the body, take a breath, ground yourself. And I'd like to ask, is this what's happening in my body? Is it protecting me from something? Because I will say, when you have grown up with a lot of relational trauma, we can have that tendency to push away relationships that are good and healthy for us because they feel so unfamiliar and feeling off balance. That could be what the dizziness is about, but that could also be something that, like you astutely observed, your system's telling you something's wrong. I don't know, because I don't know your specifics, but I do think it's good that you're developing that curiosity to at least ask. And the more I've worked with dissociation, I've learned, as a bit of self-inventory, to ask that question: what is this protecting me from? Is this protecting me from something? And is that threat that this dizziness, for instance, might be protecting me from, is that threat legitimate or not legitimate?
Next question. Do you have any advice for people who live by themselves? I find it much harder because there is no one to communicate with and it's easier to dissociate.
Well, I live by myself, and I have for most of my life. I mean, this is where, my pets have certainly helped, and staying in touch has certainly helped. Like, for instance, during COVID, I've probably been in touch with more people than before COVID, honestly, with with FaceTime or with Zoom or with. So I think that's the importance is to stay connected even if you are physically distanced. That's why I love the In the Rooms platform so much. That's really the best I have. And if that is feeling scary for you, maybe notice that scariness and ask if that again is something protective that's coming up. But yeah, you can stay in touch in a lot of ways using the technology, which is why I'm so glad that this platform is here. And it may not be perfect, but I do think it's better than nothing. And if you are not aggressively socially distancing right now, notice where you feel nourishment or connection out there in life, and continue to engage it. But I know for me, the more I've worked on my core stuff, the less and less I mind being by myself, and the more I actually relish it. So, great question, and I wish you best continuing to explore it.
There's a bunch more. I think we'll probably have to end with this one, and I'll try to type in messages or forward to Jamie the ones that
Sure.
we can't. But how does this fit with working the steps for a spiritual awakening? I was thinking with your work with the trauma and the 12
Yeah.
steps, and I'm thinking, gosh, that's a great question.
Yeah, and spiritual awakening varies person to person. What it even means, because a question I get a lot is, gee, a lot of these things that I thought were spiritual experiences, was that just me dissociating? Was that just me checking out? And there is a very real issue that we now discuss in recovery called spiritual bypass, which is where we can use spiritual teaching, spiritual practice as a way to keep from feeling our emotions. And that will show up as the people who will say, well, just let go and let God. Or do an inventory on it, when you may really need to just feel something. or reach out like human to human. So I mean, it's a great question, because I think a true spiritual awakening will help you more firmly connect with your humanity. Because so much of the yogic perspective on this is, right, that there's a human part and there's a divine part in each of us, right? And I think so many people in recovery can be afraid of their humanity and afraid of these things that caused us a great deal of shame, or fearful of our bodies, because there's this fear that our bodies got us into so much trouble. And speaking purely for myself, learning to thrive in recovery has been to love my full self, warts and all. And it's my spiritual awakenings, my spiritual practices that have helped me to do that. And if you find that your spiritual practices are making you kind of more ashamed to be human, I think that's where you're teetering with spiritual practice as dissociation.
That was great. So, thank you so much. Thank you everyone for being here today too. Great questions. Really appreciate all the input. Thank you, Jamie. Very good. If you haven't picked up her books, check them out. They were on In the Rooms. There you go. Hold up. Trauma and the 12 Steps. So it was the In the Room book for August or July.
Yeah.
For July. So check it out. There'll be more information there. And join us September 19th for the next Super Saturday Recovery Summit. Thank you, everybody.